Breast cancer screening is something that you can't think too often about. We've got Sarah Fogarty. She is the director of the Sandra and Malcolm Berman Comprehensive Breast Care Center at GBMC. Welcome.
Thank you so much. Thanks for having me.
I'm happy to have you here. Let's just start out with the basics. What are the breast cancer screening recommendations as they stand now?
Sure. There's a lot of different recommendations out there, and it can be very confusing for doctors and for patients. What we follow are the guidelines by the American Society of Breast Surgeons, which falls under the American College of Surgeons. So I usually recommend every year annual mammograms starting at the age of 40, and that's for average risk patients. There are other recommendations if you are considered higher risk, meaning based on family history, if there's a lot of breast cancer in the family, if there's a genetic mutation, those guidelines could be different.
Okay.
Sometimes women are recommended for screening mammograms starting at age 35. There is debate, though, across many different guidelines that come out, and they do change. And so it can be complicated. So
if someone has a family history, they might have to start that earlier. So that is something you want to be talking to your doctor about beforehand.
yes. Yeah, it depends. There's a lot of factors that go into risk and understanding your risk. And it's something that as a patient, if you know, oh, my mom and my aunt all had breast cancer and they were in their 40s, it's something to bring up with your primary care doctor or your GYN to make sure they're aware of that, where they can make further recommendations about that.
Now, if someone finds a lump during their routine self-breast exams, who should they call first in that situation?
Sure. And that does happen quite a lot. And most patients, I recommend to see their primary care doctor or their OBGYN with that complaint. They absolutely can manage that from the beginning, recommend what imaging is needed, and depending on that imaging and the exam findings, if they should be recommended to a breast surgeon or a breast center for further evaluation.
And what is unique about the care that patients receive there at the Sandra and Malcolm Berman Comprehensive Breast Care Center at GBMC?
Sure. I think we do an excellent job taking care of patients with breast cancer. It's a very robust cancer center with everything you could possibly need in one place, just like a large university, but with a very small hospital feel. We take very good individualized care of patients. We are available. We are easy to access. We are easy to get to. And usually it's a very simple few steps away from the surgeon's office to the operating room, to the medical oncology office, to the radiation doctor. We're all located in one central place on campus. And that can be very daunting for patients that are going to these larger universities where it's very confusing getting around and even finding a place to park. So we're very easy to access and I think very available for patients. And we offer a large amount of clinical trials, just like the larger cancer centers, and are all up to date on the most recent data and how we treat patients. So I think it's a fantastic center.
Yeah, it sounds very comprehensive. And those little things that you talk about with parking and navigating the campuses, they sound little, but when you're dealing with something with this much gravity, you want to make sure that you're doing it right and not stressed about how to get to an appointment. So that makes a lot of sense. If people want to get more information about the practice there, how do they do so?
There's a whole website with a lot of information about our practitioners and what we offer. Of course, our office number, we can provide 443-849-2600. You can call anytime for any questions or complaints. We do have a high risk clinic where you can actually access an online form where you can put in your family history and data, and we can actually assess you and see if you are considered high risk to come in for further discussion of that and recommendations. So there's a lot of easy ways to get a hold of us and to find out more information online.
All right, Sarah Fogarty, thank you so much for this helpful information. We appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.